Well, welcome to today's thinking about the coronavirus epidemic. It's the 3rd of February, and we're talking about the Wuhan novel coronavirus, which still actually is not named yet, but this is what we're calling it. It's the NCOV, the novel coronavirus. Now, so far there's been John Hopkins this morning, that excellent website that's tracking the epidemic for us. Confirmed cases 17,482. So 17,500 confirmed cases. People that have the virus, have the infection, and that has been diagnosed and confirmed. The confirmed deaths this morning, 362. Now, it's easy to say these numbers, but we have to remember these are human beings. Every one of these, of course, is a tragedy, a grieved loss. And so far, the figures are 496 people have recovered. Now, if we kind of relate that number, the confirmed deaths to the confirmed cases, we're on about 2%. Of course, if we relate that number to that number, the death rate would be totally horrendous. We know that's not the case. But what we're not sure about is the lag time. So many people still have active infection of coronavirus. Now, of course, this is an evidence-based video. We always try to be evidence-based here. But I'm going to stick my neck out a little bit, because yesterday we looked at an article from the Lancet. And that said that on the 25th of December, on the 25th December, there was 75,000 cases. It didn't say that. It said that was what their modelling suggested. And this was quite sophisticated modelling. So I know these are the official figures. They're confirmed. I'm not saying there's any deceit or anything going on here. It's just that these are confirmed, but there's obviously going to be a lot more cases that are not confirmed. So if that was the number on the 26th of December, and this same Lancet article from the 31st of December thought the doubling time was about 6.4 days, then you can probably see from that by the 31st of December, there was 151,000. odd cases, if it had doubled in that time. And today, the 3rd of Feb, that would probably give us about 220,000, just over 220,000 cases. So I'm sticking my neck out here, but I suspect this is the number of cases at the moment, based on that Lancet modelling. But it's an evidence-based site, so I can tell you that the confirmed cases are that, 17,500, and the confirmed deaths are 326. Right, now, what I wanted to talk about this morning was, as we've said, there's many things we know about this virus, the novel coronavirus 2019, and there's a lot of things we don't know. But from our previous knowledge, we can start inferring things about this virus that may well turn out to be true from our basic knowledge of virology and epidemiology and infectious diseases. And that's what we've been doing, looking at the graph of the evolution of the disease, for example. But what I want to do this morning is I want to tell you there's 7 coronaviruses, or 7 types of coronavirus, known to cause infection in human beings. 7 types. 4 of those are just the common cold. You get common cold symptoms for a few days and it goes away. It's not such a big deal. So that's 4 of them. The other 3 are MERS, SARS, and this new novel coronavirus. So what I want to do this morning is look at some information that we already know about the MERS epidemic, what we already know about the SARS epidemic, and compare that with what we know so far about the novel coronavirus epidemic, and see if this will help our thinking and help us to work things out a bit better. So First one we'll think about is MERS. Now, MERS is Middle East Respiratory Syndrome, MERS. First identified in 2012, and a total of 2,495 confirmed cases to date. But the death rate is high, 858 deaths. It's affected 27 countries at one time or another. Case fatality rate, if you get it, there's a 35% chance it's going to kill you. So quite a severe condition, but fortunately much rarer. But having said that, the disease severity is very variable. So some people get very, very sick. Other people have a relatively mild form of the disease, which of course is good. The complications tend to occur fairly early. So if the patient's going to get a pneumonia or the other respiratory complications, then it's likely to be within a week of getting the infection. The age range in MERS, it was mostly adults. Median age was about 50, but some children were affected. So some children did get it, but mostly adults. More males than females got the infection, but that might be partly to do with the lifestyles in the countries that we're thinking about, which are largely the Middle East. And there's ongoing reported cases. The last case of MERS was December 2019. And the animal reservoir is dromedary camels. These are the big Arabian camels with one hump. And the animal reservoir is where the virus lives. So these are all zoonotic infections. And when the infection comes into humans, this is called spillover infection. So this came from camels and still does come from camels because there's a reservoir of the virus in camels. So it comes from contact with camels saliva, feces, urine, and also from milk, and unfortunately camels are eaten, so from meat as well if it's not properly cooked, because the virus will be in the milk and in the meat. And the incubation period, if it's human to human, the incubation period is about 5 days, 4 or 5 days, as we would expect. And the incubation range there is 2 to 14 days. So still thinking about MERS. Let's just write MERS on the top so we don't get confused. So still thinking about MERS. Can people without symptoms spread the condition? Well, the answer here appears to be yes. People without symptoms can spread the condition. Probably here because some people get a very mild form of the disease, although it's got a higher mortality, as we know. So asymptomatic spread, yes, is possible. Mode of transmission is much the same, droplet direct contact, but adding meat and milk here from camels. So the mode of transmission is much as we've said before. But human to human spread is limited. Now this is where MERS is different from the new one we're looking at now, the novel coronavirus. Because with novel coronavirus there's been lots of human to human spread. Human to human spread with MERS is limited. It's actually quite hard to catch from someone else. Much easier to catch from a camel. This is why most of the new cases are in Saudi Arabia or in the Middle East. So preventative measures: avoid close contact, cooking meat, hand hygiene, close contact with people. the same spread, coughing, sneezing. Coughs and sneezes spread diseases. Not over the internet though. Yeah, much the same. Basic reproductive number. This basic reproductive number. Now, actually, I messed up my diagram yesterday, so I just want to go over this again. The basic reproductive number is called the RO. So if the RO is 2, the reproductive number is 2. What this means is that one person, on average, will infect 2 others. So here we see this person has infected these 2 people here. That's that bit of infectious spread. But then this person here has also infected 2 people there. And this person's affected 2 people there. Like that. And then again, this person here is infected 2 people on average, and this person 2 people on average. So that's the correct diagram there that shows the spread if the RO is 2. the reproductive spread of the condition. Of course, if it's 3, it's going to be different. 1 is going to infect 3 people. Each one of those will then infect 3 others. So that is infected 3 people there, if the reproduction is 3, and that person has affected 3 there. And of course, each of those can go on to affect 3 people on average. So that's what we mean by this basic reproductive number. Now, if the basic reproductive number is less than 1, that means each person, on average, is infecting less than 1 other person. That means the numbers of cases will go down. And the basic reproductive number in MERS is usually taken to be less than 1, so that's good. Now, there are exceptions here, but those were before the dangers of the virus was known about, and they were actually in healthcare settings where more people were infected. But generally speaking, the R0 is less than 1. R0 is the basic reproductive number. Clinical features, as you pretty well would expect, but this can be a severe disease in some people. So we get fever. When you get a fever, your hypothalamus turns your thermostat up in your brain, so that makes your body feel cold, so you feel shaking, you get these chills and rigors. Rigors is this shaking to warm up. Headache. Non-productive cough is pretty typical, actually. In the early stages of an infection, you have the irritation, but you're not bringing up lots of sputum. So a productive cough would produce a lot of sputum, an unproductive cough wouldn't. Dyspnea is difficulty in breathing. Myalgia is muscle pain. You're just achy everywhere. And what what the official medical reports of these things don't say is that you just feel absolutely awful. So these patients might have a temperature of 39 degrees centigrade and they'll feel absolutely terrible. You know, I had flu once and I thought I was dying. I didn't care if I was dying or not. That was influenza. But, you know, at work on A&E, we always tell people off for coming in with flu, with an influenza infection, because they can spread it, and rightly so. But you can feel so ill with flu that you think you're dying. So you do want to seek immediate medical help because you think it's such a serious condition, because you feel awful. Other symptoms in MERS can include sore throat. Coryza is common cold type symptoms. Now, this is another big difference with the novel coronavirus. With the novel coronavirus, it appears that most people don't have the upper respiratory features, so they don't have the runny nose, they don't have the sneezing. It's more the lower respiratory tract that's infected, so that's another important difference, a big difference. So MERS is harder to catch. MERS, you do get the coryzal features. Nausea, vomiting, sputum. Diarrhea is another feature in this as well, because remember, in the animal kingdom, the coronavirus lives mostly in the gastrointestinal tract of animals. But a lot of complications with MERS: acute respiratory failure, acute respiratory distress syndrome, ARDS, refractory hypoxemia. Refractory means it doesn't respond to treatment. So these patients, you give them oxygen, but the oxygen doesn't pick up, so they can still become hypoxic and die. And as with most bad infections, you can get acute kidney injury. That's what we used to call acute renal failure. And there can be sepsis. And the other thing that was noticeable about MERS was underlying chronic medical conditions are a big risk. So a lot of people who got this and got the severe forms already had diabetes, mellitus, renal failure, lung disease, compromised immune system. And healthcare workers got it as well. So this just shows the importance of optimising your health if you can. So if you do have chronic asthma, you can treat that. If you do have diabetes, you can get your blood sugar levels down. So optimising health is usually an option. So that's MERS. That was the MERS. And the other one that people talk about is the SARS. Now remember, this is the same coronavirus, CoV. So the MERS, the SARS and the novel coronavirus are all coronaviruses. They have slightly different genetics, but they're all coronavirus, so they're related. Remember those 7 coronavirus infections that can infect humans. So SARS was first identified in 2002. The outbreak was mostly in 2003. Overall, globally, there was 8,098 cases, 774 confirmed deaths, 26 countries were affected. Case fatality rate was higher than the new novel coronavirus, but lower than MERS. So the case fatality rate was about 10%. Disease severity, again, there was a very wide spectrum. Some people weren't very ill, others were very ill, but generally people were quite ill with this, generally more severe. We think more severe than the novel coronavirus, but we're not sure about that yet. The complications, like the novel coronavirus, tended to develop in the second week. Now, children with SARS, this is quite encouraging, children with SARS had milder symptoms under the age of 12. They still seemed to contract it, but their symptoms were mild. Presumably there's something about the young immune system that's able to combat the infection. Milder symptoms under the age of 12. Children over the age of 12, however, presented basically the same as adults. Men seem to have more severe disease than women, which was interesting. The last reported case of SARS was 2014. Now, there was a case escaped from a laboratory somewhere where the virus is being kept for study. And I think there was one outbreak in China that was quickly contained, but the epidemic finished in 2014. Now, the animal reservoir, again, SARS was a spillover infection. It is a zoonosis, it's a zoonotic spread. And that came from bats via civet cats, which presumably were being, it's just horrible, presumably being killed and eaten. That's where it came from. Incubation period, much the same, slightly less, 2 to 10 days. Incubation period for SARS. So still thinking about SARS. Still thinking about SARS. Asymptomatic spread. No. This is important. So the asymptomatic spread, people without symptoms didn't spread the disease. So do you remember this incubation period we keep talking about in our disease evolution, this incubation period here, from when someone is first infected to when they first develop symptoms? This red line is developing symptoms. So with SARS, people here are not shedding the virus. In fact, people with SARS are shedding the virus in the second half of the time they have the disease and in the second week of the disease. They're not shedding it with SARS at the start. But coronavirus, novel coronavirus, we're pretty sure now, well, there is evidence now that it's spread by asymptomatic carriers and people in the incubation phase. So that's a big difference. So basically there we've covered the two reasons why I'm concerned about the novel coronavirus. One is it is much more transmissible than the Middle Eastern respiratory syndrome. It's more transmissible than MERS. It's easier to catch than MERS. It's not as high a case fatality rate if you get it, but it's easier to catch. That means it's going to spread, as we looked at the start of this video. And the other reason I'm concerned is that there does seem to be spread of the novel coronavirus in the incubation period. Whereas a big part of the reason that SARS was able to be contained was that you knew when someone was sick and therefore you knew they were infectious. So asymptomatic spread with SARS, no. Most transmission was in the second week of illness with the highest rate of viral secretion. Mode of transmission is much the same. Human to human, yes, but from ill patients, not from well asymptomatic patients. Preventative measures, much the same. Avoid close contact, hand hygiene. Basic reproductive number in SARS was slightly higher, but of course, once it was recognised that only sick people spread it, this of course would go way down because the epidemic was curtailed. Clinical features much the same, but there were some diarrhea and upper respiratory features with it. So there were more upper respiratory features, where again with the novel coronavirus we know that the upper respiratory features are less common. acute respiratory failure, much the same complications with SARS. And SARS did seem to affect more healthy people, as does the novel coronavirus. So there is underlying chronic medical conditions to some extent, but it does affect healthy people as well. The reason I keep going on about this is because in the... now, I'm not comparing this with the 1918-1919 influenza epidemic that killed 50 or 60 million people. No one's quite sure. Could have been 80 million. But what happened there was, if we look at age here and death rate there, then what we found was that, or what the epidemiologists at the time found was that the death rate kind of had this bimodal distribution. It was kind of like this. So what that meant was that middle-aged people, sort of 40s, 50s, maybe even early 60s, weren't dying so much. Even children weren't dying so much, but young fit adults were. So this is like people in the 1920s, 17, 18, 19, 20, 21, that kind of age here. Around about, say, 20 years there. So more of those were dying than younger people and slightly older people. And again, at around about, say, 70 years of age, there was more people dying as well. Now, this is what you'd expect, especially in the first part of the 20th century, because people would be old at 70 and have other health conditions. But this wasn't expected, that there was a preponderance of deaths in young people. And this was because the immune system in these young people is very good, and the immune system caused inflammation, and the inflammation filled up the alveoli, causing the pneumonia-type features. Now, as far as we know, with the novel coronavirus, this is not the case. We would expect the graph with the novel coronavirus to be something like this, going up with increasing age. That's what we would expect. So we haven't got that bimodal distribution, which I must say is quite a relief. Now, novel coronavirus, Wuhan coronavirus 2019, identified in 2019, that many confirmed cases, but tragically, as we've looked at from the mathematical modelling, it could be 10 times that. 362 deaths, confirmed deaths, 496 confirmed recoveries, 26 countries affected so far. Case fatality rate, we're still sticking with his 2% at the moment, as far as we know. This is still the figure from the chief medical officer in my country, so I'll stick with that for now. Disease severity is very variable. So some people are very mild, have a non-specific disease. Other people have a much more serious illness. In fact, quite a lot of people have 20-30% seem to be having quite a serious illness. They have a rough time of this, but still variable. Still variable. Complications tend to occur in the second week. Adults affected mostly so far, 55-year-old being the median age. More men than women so far from the data that we have. Of course, ongoing reports. Animal reservoir, almost certainly bats. The genetics of this virus is about, I can't remember, but about 80-odd%, 85% the same as the bat coronavirus, I think. So it's almost certainly from bats. Via some other animal, perhaps. They think it's not snakes, but they're not sure now. That's being worked on at the moment. Incubation period, human to human, is about 4 or 5 days, 3, 4, 5, 6, 7 days most cases, but 2 to 14 days is the range. 14 days is the quarantine time at the moment. And we noticed earlier when we looked at some studies on this that 95% of cases had presented by, I think it was 12.5 days. So we say 14 days here. That doesn't mean to say you won't get 1 or 2 cases that are 15 days. You might, but they're going to be very uncommon. Asymptomatic spread supported by some evidence. So this is the big difference. This is why I'm concerned about this as opposed to the SARS. The SARS was not spread by healthy feeling people. This one is, which is why it is or one of the main reasons why it's spreading. So it's more transmissible than MERS, and it's transmitted more often than SARS because of the asymptomatic spread. Mode of transmission we've looked at before: droplet, direct contact, surfaces. I just heard this morning, actually, there's a taxi driver in Thailand has caught it from taking tourists to the airport and back in Bangkok, which of course is very sad. Human-to-human contact. So human-to-human contact, yes, but, this is a big but, from asymptomatic as well as sick. So symptoms, A means without, people without symptoms are spreading this. Preventative measures we've talked about in some detail. The basic reproductive number is 2.68 for the best data we have, still from that Lancet article. The features are much as we've looked at: fevers, chills, rigors, headache, non-productive cough, difficulty in breathing. Quite a few people with this get difficulty in breathing. The pains, the feeling absolutely awful. Anorexia, not feeling hungry. Again, that's very common in infections. Anytime you really don't feel hungry, the body goes catabolic. It's part of the natural way that the body promotes healing. It leaves plenty of energy left for making antibodies and things like that. So that's quite normal. Diarrhea, again, can occur with the new coronavirus. But from the data so far, mostly absent upper respiratory symptoms. So these patients usually don't have cold type features, common cold, coryzal type features. Complications, much the same for all of the coronaviruses. And most people at risk seem to be previously healthy, but people with chronic underlying conditions to some extent. So that's a comparison with the known coronaviruses. So the 4 common cold coronaviruses aren't a big problem. The MERS is an ongoing problem to some extent from camels, mostly ongoing zoonotic spread. The SARS we don't have anymore, thankfully. And the novel coronavirus, I'm afraid, I think is going to carry on spreading because it's quite transmissible.